This is Damian McNamara reporting the American Academy of Family Physicians Congress of Delegate meeting in Orlando. And with me is Dr. Roland Goertz, who is the outgoing president of the AAFP and the incoming board chairman. You are going to be talking at the RUC committee coming up sometime later this month. Can you tell me, they're going to give you 5 minutes, you said, to sort of give your speech and what your demands are on behalf of the AAFP. Can you tell me what they are and what you plan to say?
Certainly. On September 23rd, we have an invitation to explain the letter that we sent to them in June about the changes we would like to see in RUC. To sum them up, we've asked for more slots for primary care representation and also including a slot for geriatrics on the RUC panel. We've asked for them to change their voting procedures up to be more transparent as far as how decisions are made. And we've also asked them to include public or non-physician members because we believe that non-physician members have significant amount to contribute to the process of RUC, particularly those that understand medical and health economics.
There's a pending cut of 29.5% in the SGR coming up in January if nothing happens between now and then. So what is your message for family physicians regarding what they should do between now and the end of the year to fight this cut?
Don't go to sleep on this issue. We've been fighting it for 10 years. Don't get fatigued about contacting those who represent you. This is a big, big deal. 29.5% cut, in a payer source, particularly Medicare, is going to put some practices out of business in some locations. So mobilize yourself, contact your elected officials, and if you feel comfortable with it, make sure you involve your patients because your patients are going to be the ones that are going to unfortunately suffer the outcomes if nothing's done.
There's the feedback to the Super 12 committee. You're saying that's also important regarding this. Can you tell me why the feedback is so important to them and how the video project you're doing ties in with that?
Exactly. The Super 12, the Deficit Reduction Committee, has the purview of being able to cut across all silos of cost. Pretty massive task if you think about the entire federal budget. But they have some procedural protections that make it so that if they choose to deal with the SGR issue and payment issues, they could do so. So that's an important issue. They get protection. Whatever they recommend on November 23rd, if indeed they do so, is an up or down vote. It's not subject to filibuster, and it's only subject to a majority vote. Those are big, big issues. But since they're dealing with the entire federal budget, you can imagine how many other organizations and how many other people are trying to contact them. So we have charged our staff and us to think about in an innovative way to try and reach them. So we're going to create vignettes of member physicians talking about what this impact could do to their practices and potentially to their patients. And we're going to urge every member to send it to as many people as they can send it to.
So you're the outgoing president at this point. Can you tell me how optimistic you are based on your past year of experience about these things going forward?
Well, my theme this past year is now is our time, or our time is now. I tend to use one or the other two versions of that. And I really believe that more people are talking about the importance of family medicine and primary care as a basis for our health care in the future than I've ever seen before. I can go to D.C. and I don't have to explain family medicine to anybody anymore. So I'm optimistic about what that future has as far as primary care and family medicine is. We have some challenges, there's no question. Dealing with budget deficit reduction and other issues are a challenge. But as more and more people understand our value in family medicine, I have to be optimistic.